Good afternoon, everyone. I hope you're doing well. Thank you for joining us on our webinar today. Just give everyone a couple seconds to trickle in and Rob a moment to pull up his screen. Just bear with us here. Just so everyone's aware, we will be recording this webinar and we will get the recording out to you probably tomorrow or the next day so that you're able to rewatch it. If you have any questions, you're able to share it with any of your colleagues if they're interested. And we're also going to be answering some questions during the webinar. If you have a question you'd like us to answer at the Q&A at the end, please toggle up to your top right. You'll see a little question box. If you put your question in there, we'll make sure we get to it at the end. And if we don't have time, we'll reach out to you directly with an answer. So those are our housekeeping items. We'll also be sending a brief survey after just to see your experience with the webinar, see if you have any suggestions for our next one. Throughout this webinar, you'll see 2 polls. We'd appreciate it if you could give your answer to those, try to keep it an interactive experience. So we'll kick off now, just in the interest of time. Welcome to the Leveling Up Adopting CoC Evidence-Based Accreditation Care. So my name is Jillian Zellman. I'm the Customer Success and Market Research Manager at mTuitive. Joining me today is Rob Dean, our Support Coordinator. If you're a customer of ours joining us, I'm sure you've worked with Rob a bunch. And Eric Nowicki will also be joining us for the Q&A session. He's our Business Development Executive for our Surgery and Insight Solutions. So our agenda today, we're going to be going through some introductions, which I just did. Rob is going to take you through a bit on increasing Synoptic adoption and compliance rates, how we suggest you go about doing that, as well as diving into Synoptic data and real-time monitoring for CoC accreditation. He's then going to jump into a bit on evidence-based standards and improving outcomes with compliance tools. And then, like I said, there'll be a Q&A at the end, so please at any point drop some questions at the top there, and we'd love to get to those for you. So I'm going to hand it over to Rob Dean, and he's going to take it from here. Thank you.
Thank you so much, Jillian, and thank you all for joining us again. Really appreciate it. Just a quick background on mTuitive for those who aren't familiar. We were founded back in 2002. One of our co-founders was a surgical pathologist, Dr. William O'Toole, who wanted to take his surgical pathology reporting and turn it into a more structured format, a synoptic format, to use for a bunch of different reasons that would end up benefiting the patient and end up benefiting pathologists and other physicians and surgeons and so on. Since then, we have over 750 facilities using mTuitive solutions worldwide. We also have partnerships with the College of American Pathologists, the Commission on Cancer, American College of Surgeons, the International Collaboration on Cancer Reporting, along with a bunch of relationships and partnerships with laboratory information system vendors, EHR vendors, and a bunch of others since then as well. And that's just to paint the picture that we have over 20 years of experience with synoptic reporting, and we've been working in this arena now for that long and have surgical synoptic solution for over 10 years now. So what we're going to talk about today is based on our experience working with our customers, working what we've seen in the industry, working with other facilities and other partners as well. Another background, just for those who may not be familiar, though I'm sure most are at this point, what is synoptic reporting? So synoptic reporting is taking any unstructured text, large pieces of paragraphs or sentences or anything unstructured, and basically adding structure to it, creating sort of field and responses. This has a bunch of benefits, which allows people to know exactly where to look for specific responses, look for specific pieces of information. There's a shared lexicon, so you're always using the same vocabulary to allow you to better understand exactly what happened, to cut down on ambiguity and subjectivity. All of this expedites communication, which expedites patient treatment, and allows for better insight into what is going on for the patient. And if done correctly, also with synoptic reporting, each piece captured is a piece of discrete data that can be used downstream. And this is especially important these days because we all know data is the new currency. No matter what aspect or department you are in at a facility, data is very important to you right now. If you're a physician, it's evidence-based care, and being able to know exactly what you're doing that's working well, what the helping out with outcomes, what's the best approaches, what's the best way to get into different treatments, and so on. But also, if you're HIM or cancer registrars or any other departments, coding and billing, all of these things are pieces of data that need to be better looked at, better explored with dashboards and reporting tools and analytics in order to better understand, what is going on at your facility in order to make those requirements, those standards, and all the best practices that you already employ in your treatment of patients. So it's important to note that data is a new currency, and therefore the best way of capturing it is to use synoptic reporting, which is why the CoC recently, or the past couple of years, launched a new synoptic reporting initiative for surgery. It's only currently for a few sites, procedures, disease sites, but they have authored multiple protocols. Those will be required soon. And it needs to be part of the post-operative report. So it's not just an add-on or addendum or another form. It has to be within the post-operative report itself and submitted that way. So each of these now have pieces of synoptic fields that need to be completed. As you can see here, this is what we've authored at mTuitive with our mTuitive surgery product. There's different levels of complexity and different levels of detail that's being captured depending on the procedure and what requirements that the facilities are seeking. But it's important to note that each of these are required compliance if you want to be accredited by the American College of Surgeons Commission on Cancer. But there's other requirements as well in terms of synoptic reporting. You can look at the NAPBC, or on your screen now is the NAPRC questions. And what's important to note about these isn't just that there's more synoptic fields and there's more synoptic reporting that has to be done, but it's also that these are quality pieces of data that are being captured. So it's not just, it's for evidence-based medicine. It's not just, did you capture this or report on this or document this? It's also, are you doing it correctly? Is the physician performing correctly? Making sure that they're sampling the correct amount of nodes, or they're resecting to the right distance, or what have you, depending on the procedure itself. So therefore, it's a two-pronged issue, right? It's adhering to these new reporting standards. So making sure that people are using synoptic fields in their post-operative reporting for those sites. But it's also adhering to the new surgical best practices, making sure that you're doing the procedure the correct way for best outcomes necessary. Or another way of breaking out even further, for ensuring compliance, you have to have surgeon adoption. You have to have the surgeons using this new requirement and being in compliance with that. And they have to do it consistently. They have to go through and make sure you use it for every case that it's correct for. So every curative colon resection, they have to be able to be capturing that information every single time. And they also have to do it thoroughly. So they have to make sure it's comprehensive and have a complete report there. So there can't be any required fields that are left blank that are for the CoC compliance. They have to be all within there, and any other requirements that your facility may have. But the other half of that is identifying these cases, being able to track where there should be these reports done, these synoptic reports done, being able to see how well these physicians are doing with these metrics, and be able to look in and see, whether or not they are meeting these standards, both in terms of the reporting as a whole, but also the specific fields that are being captured. And so a two-pronged issue requires a two-pronged solution. You need to ensure compliance and also monitoring compliance. So for ensuring compliance, you need to make sure that you have a solution in place for synoptic reporting for surgeons that they will adopt and use. And then on the other side of it, you also have to have data downstream that you can monitor and interrogate to see the best ways of improving that quality being captured. For mTuitive, our mTuitive surgery product, we found the best practice is to have a workflow that's a hybrid approach, which is to say it is both synoptic and also unstructured fields as well, the narrative text fields as well. So therefore, you're able to capture pieces of synoptic fields such as diagnoses, complications, the CoC fields, et cetera, anesthesia, all the good stuff there. But you also allow for two other fields or some other fields where the surgeons are able to dictate and still complete the report their normal narrative way that they've been trained to do. Another thing is required fields. So for required fields, that means that these are fields that have to be completed in order for the surgeon to sign out. So if your synoptic reporting solution doesn't have this, which many do not, you want to have this in place. What basically means is that you cannot have an incomplete report. They can't skip over these CoC fields or whatever required fields you may want, for joint commission or for whatever initiatives you may have at your facility. These have to be completed by the physician before they're allowed to sign out. And so if you have these hard stop in place, then it forces a complete report. So therefore you will be in compliance, and therefore you are capturing that information as you need. And then another aspect that we strongly recommend you have in your synoptic surgical reporting solution is logic branching. It's easy to be bombarded with a bunch of questions. And for a physician, that's just not an efficient way of going through these checklists or these synoptic fields. What it is instead is being able to go through and seeing exactly what is relevant to your case. So, depending on what you've answered before, depending on what you actually did, those are the questions that should be presented to the physician. That's what needs to be. So they're not going through anything irrelevant. They're not going through anything extraneous. They're simply focusing on what is actually important to the case and what actually occurred. Again, it helps for efficiency, it helps for adoption, and it helps for them to complete more reports using the synoptic fields. But it's important to note that it's not just about the adoption of the synoptic reporting. It's also about what is being captured within the synoptic reports. These are quality-based fields that need to be looked at to see how well the physicians are doing, how well the facility is doing, and that takes time. Having to go through and find these reports within your system can take a lot of time. That manual abstraction piece of, just literally searching for the reports themselves and then having to pore over the reports within the details themselves to find the information you want to abstract and pull out. All of that takes time. And so the fact of the matter is a lot of the current, baked in EHR workarounds simply fall short, and they don't have the methods in place for complete reports and for tracking these pieces of discrete data. In fact, most of them aren't capturing it as discrete data, and that's a real problem. So that's a part of the compliance issue that may be overlooked quite often, is that it's not just about being able to have the surgeons doing these reports in this manner, but it's also how you're tracking it and how you're monitoring it. And with that, I'm going to bring us to our first poll. So that should pop up on your screen momentarily. Just asking about your current workflow. I'll leave it there for just a moment. So if you can please go ahead and complete that poll. Helps us know, what's going on with everyone out there. Thank you so much. Appreciate it. All right, we'll move on now. Thanks again. Okay. So as we talked about, the second prong is monitoring compliance. For mTuitive, our solution to that is mTuitive Insight. What it is our analytics and database repository solution. It allows you to look at specific pieces of data, look at reporting as a whole, but also look into the fields themselves. And what you need is a solution that does that. You need to be able to have a manner or way of tracking the compliance. So you're not just looking at how many of these reports are being done in order to meet the thresholds that CoC has put forward. We also want to look at the discrete data within it and how those are matching up with that quality. So again, you need to have something in place for your solution where you're able to use that discrete data that you're capturing currently and actually monitor it and see, okay, how many reports should be done? How many reports were done in this field? How many, are we meeting that 80%, 90% threshold for CoC? And as you go through it, there's make sure that there's other ways of looking at that data, using the data as much as possible to learn more about the best practices possible for each physician and for each facility. Right? You're able to go through and not just see, of course, the completeness rate of these compliance, but you're also able to see exactly what's going on within the reports themselves. Are they hitting those qualities? Is your facility, continuing its great record of great offering tremendous care, using these best practices and these standards that CoC has put forth to track these quality indicators. And these evidence-based standards, require, again, a way of understanding exactly what has happened, being able to look and see which ones are falling short, where there needs to be an intervention, where you either have to speak with a department, a specialty, a specific physician, what have you, and find out ways of correcting it. It's only by capturing this information they're able to know where things are and where things need to go, where they need to be. And in order to do that, you need to be able to capture this information in a discrete manner, but also look at it and monitor it in an analytics solution that has a robust way of looking into exactly what is being captured and what is being performed. So to recap again, when you're thinking about these new CoC standards and working with surgical synoptic reporting, it is a two-pronged issue and solution that is needed. First is to ensure compliance. You need to have a way to make sure that it works within the surgeon's workflow and that ensures completeness of reports and makes it as efficient as possible while capturing as much important information as possible in as discrete fields as possible. Once you have that and you have that adoption up and you have that consistent usage, then you're able to also monitor that and you're able to see, is it actually consistent? Which physicians are lagging behind, which specialties are lagging behind, where does there need to be some sort of intervention, where does there need to be some sort of change or course correction, and make sure to do it in a way that is efficient enough so it's ready for not just the auditing, the accreditation auditing, but also for your own initiatives, for your own healthcare initiatives and patient care outcomes. So you need to basically have that two-pronged approach ready. So when you're thinking about adopting these synoptic solutions, make sure you have something in place that allows you to ensure compliance and monitor compliance as well. So with that, I'm going to go to the second poll. I'll leave that up there for just a moment before we get into our Q&A. Thank you all again. We'll be leave it there for just a few moments just for everyone to fill it out. And then after this, we'll jump into the Q&A. And then, and Jillian and Eric will rejoin us for that. Excellent. Great. Thank you.
Awesome. Well, thank you so much, Rob. We appreciate you going through that for us. We did get a few questions along the way. We've got about 10 minutes in this webinar. We kept it short and sweet this time for you. And if you have any others that came up throughout, please just go to the top right there. There's a little question mark inside a box and drop in your question and we'll try to get to it. So first question that came up here, Eric, I think this would be good for you. What can I do with this data, and can you compare this data with your pathology data? You might have noticed we only showed some surgery reports and insight, but can it be compared if you have pathology synoptic reporting?
Sure, yeah, that's a good question. And thank you, Rob. That was a nice presentation. So both mTuitive surgery and mTuitive pathology use concept mapped structured data with unique identifiers. So that data can be used in real time to generate reports, metrics, data sets. It can be used for research, measuring quality outcomes, and cancer accreditation, like we're here today. But they can also be used for machine learning, data sets, AI. As an mTuitive surgery customer, though, you can leverage other parts of the post-operative note in structured formats to pull insights. Like we have customers that are capturing, which Rob talked about, drains, anesthesia, complications, and procedures, diagnoses in structured formats, so that they don't have to wait for abstraction to get access to that data. They'll get it in real time from mTuitive. And then as far as pathology is concerned, though, these programs are, they share a name. They're quite different. In surgery, it's specifically a quality program to reconcile if a surgical technique is done in a certain way. And obviously, our pathology reports are quite a bit more substantial and dive deeper into some granular data. But great part is since it's all in mTuitive, it's all structured and concept mapped, it would be available in Insight, which Rob also talked about. So hopefully that helps.
Amazing. Thanks, Eric. This next one I think would be good for you as well, Eric. Why do hospitals, or why would a hospital choose using an mTuitive solution over building an EHR-based solution, or kind of creating a do-it-themselves solution for synoptic reporting?
Yeah, it's another good question. I think there's a bunch of different reasons why. In the beginning, it seemed to be more of our forward-thinking hospitals that were trying to get ahead and future-proof a solution based on the predicted expansion of this program. In conversations with the College of Surgeons, they see this being like a 40 to 50 surgical procedure program down the line. Obviously, it's not there yet, but then also to address either IT issues like bandwidth or clinical bandwidth. Some of our customers have decided it just makes more sense to outsource this than to put more resources into an administrative program versus into patient care.
Great. Thank you. This could be good for you, either you or Rob, Eric. It's kind of a support-based question. How do we ensure adoption among surgeons when we're setting up our surgery solution and launching at a new site? Are there specific ways we go about that? How do we run training to ensure that these surgeons have everything they need to adopt this new solution and this new workflow, which we know can at times be disruptive to have a new workflow in place? How do we ensure adoption at that site?
Rob, do you want to take that, or do you want me to?
Sure. So we have multiple approaches that we work with a bunch of different departments at your facility. And so anytime you have this synoptic solution that you're launching, make sure to involve as many departments as will be impacted. And it turns out there's many of them. And so we work with HIM departments, cancer registrar departments, the physicians offices, coding, billing. We work with all of them along with IT and whatever EHR and other groups to make sure that we have a successful implementation. And so you want to make sure that when you're doing this, you have all these people at the table and everyone is, because they will all be impacted in different ways. And so one of the things that we do is, in addition to bringing everyone together, is also we make sure that we get sample reports, operative reports from facilities, see, because every facility and even every physician documents in a different way. And we want to see, what fields are you capturing? What fields do you want to capture? What fields do you want to capture discreetly? What fields, do you want to capture otherwise? And then we work with physician champions. The facility will say, these are the people for these particular procedures that you really want to meet with. So we consult with them and we go over, the authoring that we've done, and we make it so therefore we're capturing all the required fields for CoC, but we're also capturing what is best for that facility for their own purposes, whether it's research initiative or outcomes measurements or what have you. So we work with these physician champions as well to install it. And then when it comes to training, we work with the sites to either set up in a train the trainer type situation. We train directly with the surgeons. We have basically, since we have a bunch of different weapons in our arsenal for training, we're able to therefore have a much more integral meeting with the physicians to understand their workflow, understand their concerns, but also point out, what they're gaining from this change. And, there will be, resistance, there will be people with objections, but, ultimately you can point out, what you're saving by doing this, what you're providing by doing this, and why it's, the better way forward and why it is ultimately the future of reporting.
Awesome. Thank you, Rob. Yeah, what I hear most from our customers, I think, is great feedback and compliments to our support team, to yourself, Rob, and our other support team members. So that's always great to hear. We definitely offer white glove support here at mTuitive, and that's a huge reason why we do what we do, is to make this easier for surgeons, for pathologists, data analysts. So let me see, what other questions do we have here? Again, if you have any more, we've got about 3 minutes left. We're going to end right on time, though. You can drop them at the top in the chat there. There is one question here, Eric, I think would be good for you. It's about future plans. I think you can delve into it a bit more. Are there plans to add synoptic fields for technique and procedural descriptions like we have in our pathology solution? It sounds like this is a pathology customer as well, which is great.
Yeah, another great question. So the CoC requirements are really just a slice of the full cancer protocols that were released through, I think it was the operative standards for cancer surgery manuals. So they actually have released full protocols for that you could do an entire synoptic operative report with. The CoC is only requiring a handful of those. So we're sort of taking guidance from them as to what's going to be required and what's optional. We do have some customers that are already using those full protocols as a best practice. I know disease site specific, NAPRC for rectal excisions. They have a more expansive protocol that's coming out in June 1st, 2026, that includes some more technique findings type questions that you would find in the narrative section. But we're still waiting on guidance for expansions from CoC ACS.
Amazing. Can you delve into a bit, Eric, quickly, since we only have a minute, how we partner with ACS and other accreditory bodies?
Sure. Yeah, absolutely. So we license the IP or the content from the College of Surgeons. So what happens is when they release a new disease site, they reach out to us, and we get it ahead of time, and we author it into our software, like Rob was talking about. We have a proprietary authoring tool that allows us to structure these reports. Then we reach out to our customers and work with them to develop their internal workflows with the new accreditation requirements, sort of merging them into this third new customized document that then the surgeons get to take a look at. They can tweak and make it their own, and then we'll deploy it to their test environment using whatever best practices they have for new templates at that hospital.
Great. Thank you, Eric. I think this will be our last question, should be a quick one. Eric, what EHRs do we work with? It looks like this site's doing a new implementation of Epic soon. Do we work with Epic? How do we go inside the EHR flow?
Yeah, that's another great relevant question. So all mTuitive applications are validated by the Epic showroom. I can provide websites if anybody's interested in taking a closer look at our validation, but we're also validated by the Oracle, OPN, Oracle, sorry, I forget so many acronyms.
New acronyms
Apologies.
every day.
Yeah, I know, exactly. It used to be the Cerner code program. We're validated by Oracle for surgery and pathology. We integrate with Meditech, Allscripts, and then any legacy systems out there. We can do an HL7, scheduling
Great.
feed, ADP, SIU.
Thanks, Eric. We're about to be cut off here, but we do work with every EHR. Thank you for joining us. We will get you the recording shortly, and we really appreciate your time. Thank you, everyone. Thank you, Eric. Thank you, Rob.
Thanks, Julian.
You all.